Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a podcast show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry.
Thank you for tuning into Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice, brought to you by the American Academy of Pediatric Dentistry. I'm your host, Joel Berg, and thank you to our Pedo Teeth Talk sponsor, Hugh Freedy, for helping us bring you great content. We couldn't do this without them. Visit them at www.hughfreedy.com. That's hu-freedy.com. We're here today with Dr. Kevin Donnelly, President of the American Academy of Pediatric Dentistry. I urge you to look online for Kevin's extensive curriculum vitae. And we're here today to talk about the age 1 dental visit. So we're going to jump right in, Kevin. First of all, thank you so much for taking your time to be with us today.
My pleasure.
Well, Kevin, we've talked about the age 1 visit for years, several decades, and I know you're going to touch on how long this has been going on. We have a lot of things to cover related to it, but it couldn't be more timely than the current scenario that we're in. And I just want to ask you, first of all, why a lot of these questions are going to be obvious to our members and to the community, but it's really important that we cover them very specifically. So why do you think it is so important for a child to establish a dental home by their first birthday?
Well, Joel, as you know, we have been discussing this for about 30 years now, and we think it's absolutely critical, particularly now that we have evidence that dental caries starts at an earlier age. We see it prevalent, at age 2, and particularly from age 2 to 5, it's increased for the first time ever in history. We've seen an increase in dental caries. And so I'm just delighted to try to really push this year as president to establish a dental home for your child. And I think most of our pediatric dentists know that, but I want this to go to all the general dentists too, and the general public, that if you can establish a dental home by the first year of age, that's before a child has any dental decay, and we actually can go into a great prevention mode. Just like the medical home that it resembles, the medical home where you take your child to get their immunizations for prevention, this is our opportunity in dentistry to really push prevention and maybe have a child go cavity-free their whole life.
Well, there's no better opportunity than early age, right? So that's what we all tell our
That's absolutely correct,
parents.
Man.
So when we first started discussing this topic, Kevin, just a short while ago, that this was such an important topic, the fact that we're talking about something that is something in our minds all the time and making it into a podcast suggests that maybe the community as a whole aren't bringing their kids in at an early age as often as we would like. Is that correct?
Well, I'm sorry to say that a recent survey that was done of parents showed that 75% of them did not bring their child in by their first birth date. And we've been pushing this for 30 years, as I said, Joel. And so that's why this is the highest priority for me, is we really need to get these kids in, establish a dental home where they can have ongoing, comprehensive care. And we really can hit prevention at age 1 before they have any dental decay, and hopefully prevent the child from having to go through any experiences with that.
So do you think the fact that 75% of parents said that they weren't bringing their kids in by the first birthday is because they weren't aware that it was a good idea, or it just wasn't important to them?
Well, I think it's a lot of factors, Joel. But first of all, these same parents, over 90% of them said they thought dental care was really important for their children. So I think it's a number of factors for parents. Number one, I think that it's probably not high on their priority list because they have a lot of things going on in their head. And, the first tooth doesn't come in until 6 months, so they're not really thinking dental yet. I think another one is our historical background. Kids traditionally didn't go to the dentist until, somewhere between age 3 and 5. And now that the caries boom has really stepped back in by age 2, we really want to get them in by age 1. And I think also there's sometimes a problem finding a practitioner that will actually see a child that young. There's about 10% as many pediatric dentists as there are pediatricians. So when you look at that difference, I think you can see where there might be a problem in finding a dentist that will see a kid that young.
So speaking of that, what other professional organizations endorse our recommendation for the age 1 dental visit?
Well, of course, the American Dental Association supports this. They understand that kids are getting dental cavities earlier in their life, and they think this is the best thing we can do in prevention is get them in as early as possible. But what I'm delighted about is this is also endorsed by the American Academy of Pediatrics. And I think that's absolutely critical because, this is really what we model the dental home after is the medical home. And there's nobody more than the American Academy of Pediatrics that understands how important prevention is. And so they've jumped on board to try to help us with dental prevention as well.
I remember a couple of decades ago, I think you and I are both, you're a kid compared to me, but we're old enough to remember when the pediatricians didn't want to support our recommendation for age 1 because I think it was a pediatrician in Philadelphia picked up the phone book and called a bunch of pediatric dentists, and this was a long time ago, and couldn't find that many that would see a child at that age. That's very different. And we're going to go into that a little bit later, but would you say that's quite different today?
Oh, it's significantly different today, both for pediatric dentists and general dentists.
That's fantastic. So the next question, and again, these are all questions that I think every pediatric dentist is aware of, but just for the purpose of alignment, so we're all talking the same language, thinking the same things. In a few minutes, tell us, please, what one can expect at a child's first dental home visit. And I think we're hopeful that parents are going to listen to this podcast today too. So what would you tell those parents about what they can expect at their child's first dental home visit before the first birthday?
Well, actually, it's a lot of things, but it's mostly counseling them. Remember, we're trying to get these kids in by age 1 before they have a cavity. So it's a lot of talking to the parents. And we'll talk to them about, number one, how critical daily oral hygiene is. And, this is a preventable disease. And when we were talking about our friends at the American Academy of Pediatrics, I think the thing that really kept them engaged all these years is this is a chronic infectious disease. And it's preventable if we can get parents to really brush kids' teeth at home on a daily basis. So a lot of time is spent on oral hygiene. Of course, we go through diet counseling, and we'll probably talk about that a little later.
Yes.
Growth and development issues, I think, is always a factor. Parents want to know about habits because they get concerned about thumb habits or how long should I use pacifier or how long should I use the bottle, things like that we talk to them about. Of course, we talk to them about trauma because between age 1 and 2, those kids are really taking tumbles because of their walking, and they're not great at it yet, hitting end tables and everything else. And so, we want to talk to them on what they can do about prevention of trauma, what they can do if they do have trauma. And all these things are absolutely critical. And, of course, I'm going to toss fluoride in there, too, which is obviously our number one preventive agent that we've had for decreasing dental decay.
So a lot of the things that you just mentioned in terms of this conversation you've described for our parents that's going to happen at that age 1 visit are often referred to collectively as anticipatory guidance. You're going to trauma is a good example. What do you need to look out for?
Right.
How do you prevent for it? It's kind of like, putting the child locks on the cabinets. In our case, it's mouth guards and other things to be careful of. So tell me more about how this anticipatory guidance fits into the dental home and, a little bit more on that one, because, I remember where you and I trained, I remember vividly the picture of the eruption hematoma, and which is pretty common,
Yeah.
The picture, and parents, that's actually in the top 10 of reasons parents come in and they go, oh my God, the kid's 2 years old and they got this second molar coming in and there's this purple going on there. And if you didn't tell them about it in advance, they're scared to death. And if you did tell them, you're a hero because then they know, oh, Dr. Donnelly said that's going to be okay. So, yeah, so I think that's a good example. But I think tell me tell me a little bit more about this anticipatory guidance and how and why it's so important.
Well, we really, just like you said, Joel, we want parents to understand what they should expect at different milestones in their kid's life. And obviously at that first appointment, we're eventually going to get to examining the child's teeth and talking to the parents about that. But before, we expect some crying on some of these kids, and that's okay. It's normal. But we really want to hit on this anticipatory guidance first while the parents really alert about this. And there's different things on what I think they should expect. And, for instance, I'm just going to bring up a few examples. For instance, with fluoride, traditionally we did not brush kids' teeth with a fluoridated toothpaste. And as of November of 2014, the American Dental Association came out and started recommending every child's tooth should be brushed with a fluoridated toothpaste as soon as it erupts, even the baby teeth. And, of course, they recommended only a smear layer for infants, and then for toddlers, the pea size. And as they age, then going to, a normal centimeter of toothpaste on a toothbrush. But this has been a big change, Joel, for people that graduated when you and I did, because, at that time, even dentists told parents, don't brush with the fluoridated toothpaste until the kid's at least 2 years old, and some even up until age 5 when they can spit well. And so this has been a major change that people need to know about. I think they need to know how important fluoride in the water is. Mostly it's a topical effect, but, it's probably the number one thing that we have, particularly for those kids that are at high risk, low income, that we can do for them to help prevent caries. And, of course, then we have our professionally applied topical fluorides. And we'll do that right in the office. And typically on these young kids, we choose, obviously, sodium chloride varnish. But there's different stages of age where we might choose to use a topical fluoride gel rather than that. And I think that's a good example of it. I think that, when you talked about that hematoma being a big issue, the number one, for me anyway, the number one emergency in dentistry on little kids is right around age 5 to 6. And it's always when the parents call, they have double teeth.
Right. That is an emergency, right?
That's
an emergency, yeah.
Yeah, and it's easy to just talk to them on the phone over that. But if you've told them in advance, they don't freak out. And, it's normal for, the permanent mandibular incisors to come in. And as those lower teeth come in, they eventually will probably make those baby teeth get loose and fall out. But I think if you tell a parent in advance about that, I think it's a good thing. Parents like to know definitive answers. And so, for instance, when I'm asked about pacifier use, I say we recommend 2 years at the latest to remove it. But, there's different situations for different kids. But that's in general what we recommend. We recommend they stop the bottle by age 1. And the great thing about anticipatory guidance is we can tell them how to make it happen. Because if the kid starts crying, if you give them that advice to, start cutting it back and putting water, maybe 50% water in that, and then 75% water in it, I mean, I really think it helps a lot in that concern.
Yeah. No, I think it's a great thing. So we will now pause for a word from our sponsor.
Hugh Freedy is the global leader in dental instrument manufacturing, offering pediatric restorative solutions that keep you performing at your best. For more information on Hugh Freedy products, visit www.hughfreedy.com/AAPD crowns.
We are back with Dr. Kevin Donnelly, President of the American Academy of Pediatric Dentistry, talking about the establishment of a dental home by the first birthday. Kevin, we were talking about anticipatory guidance, and you had referred to several things, but also we touched on diet. And I want to mention to our audience that as we record this, we're in the middle of the coronavirus crisis, and nothing could be more timely than talking about prevention and home care, which is what we provide during this age 1 visit. And a big part of that, of course, is diet, as you referred to. And, just to get into a question for you, I think when I heard that the toilet paper was all depleted in the stores, The other thing that I saw online that was depleted was goldfish crackers from Costco. So, I don't know how many parents are feeding their kids this sort of like IV drip of goldfish crackers. And when I hear that the children are at home now for the moment and they're eating goldfish crackers, we're going to have a crisis on our hands a few months from now. So, just briefly, I mean, we all know this, but, this becomes more important than ever, right? Talking about diet and caries.
Absolutely. And I've put a lot of thought into this because now these kids are homebound. They're with their parents. They're homebound, not just as infants, but they're actually taking classes online now at home. And so they have access to whatever those parents have available at home. And we're not talking now just about after-school snacks. Just like you said, Joel, they can be snacking on these all day long. And when I sit here and I think about that, I know most practitioners are just providing emergency care right now. And I said, what a great time to maybe update your webpage and really stress on this. You've got to be careful about this at home, that your kids aren't snacking all day long because it can increase that sugar exposure to their teeth. But likewise, since we're talking about the dental home, as soon as you anticipate your offices opening back up, I think what an opportune time to really get these young kids in.
Yes.
Typically, we do toothbrush profies, right, with fluoridated toothpaste. We go through all this anticipatory guidance that we've been talking about. And I think it's just a perfect time to get these little kids in. Most of what we do is talk, a toothbrush prophy, maybe apply some fluoride varnish, and there's no aerosols. That's the big thing that we're concerned about right now. There's no aerosols created. And so an opportune time to spend time with that parent and really talk to them about their child.
And we'll figure out ways. The community is inspiring in how we've responded to this crisis, and we're going to figure out ways to manage all phases of dental care, including aerosol generation. But at the outset, this kind of thing, like age 1 dental visit that does not generate an aerosol, is going to be a great advantage and really the most important thing. So let me move on and talk about evidence related to the dental home. And I know there's plenty, but can you just cite some evidence for us that establishing a dental home by the first birthday, and this is for our parents as much as it is for us because we know this, that it decreases decay and reduces the number of cavities?
Yeah, there's some good data out of it. Some of the early data came out of North Carolina that if you see a child by their first birth date, in fact, the cost of care goes down. But to me, the most important part is the reason that cost of care goes down is because you don't have to do fillings and restorative dentistry near as frequently. And that just makes me happy to hear stuff like that. We established the dental home program here in Texas through Texas Healthy Steps, which is our Texas dental Medicaid system. And we are so happy to follow that in South Texas. I live in San Antonio, Joel. We have tracked this dental home since it was introduced, and there are significantly less needs of these child in the long term. Obviously, we're saving money, which we'd love to see put back into prevention, but we are seeing a lot less care on the children that we get into the dental home and their siblings also. It's a good thing.
That's all a great thing. So if I'm a parent out there listening to you now and I call up a dentist and find they don't see children until age 3 and they say maybe what's not necessary until age 5, what should that parent do?
I recommend that they go to mychildrensteeth.com and they or AAPD.org, which is the American Academy of Pediatric Dentistry's website, and you can click on a button that says Find a Dentist. And we know that you were talking about earlier, a number of years ago, maybe 20 years ago, only 25% of our pediatric dentists would see a kid by age 1. And now we're proud to say we're over 70% that will. And so I think you can find a dentist that way put your zip code in that's near you that actually will see these kids. Talk to your friends, what are they doing with their 1-year-olds? Or just call several dentists and say, are you seeing kids at age 1? But I think the easiest thing to do is to go right online and find someone that will establish a dental home for a child by age 1.
I want to touch briefly, Kevin, on the dexterity level at different ages and, the fact that a lot of parents kind of overestimate what their kids can do at age 2 or 3 or 4 in terms of brushing their own teeth. We know it's a lot later on. I sometimes tell parents that, I believe your kid can do differential equations, but I don't think they can brush their teeth independently. So I think, reminding our parents out there that while their kids are at home, what better time than to take advantage of making sure we're looking at every surface and we're following the teeth around the corners, cleaning the teeth carefully. So the parents do have that obligation. So I wanted to see what you wanted to tell us and tell the parents today about how they should interface with their kids in brushing their teeth.
Well, I know that a lot of pediatric dentists are listening to this, so I hope I'm representing you well when I tell the parents that are listening, you really have got to brush your child's teeth. And if there's one absolutely critical thing you can do at home, it is brush your children's teeth. We recommend it until they have the dexterity to be able to manage that toothbrush well and brush for themselves. And although every kid has a little different level in dexterity, we assume that by the time they're able to tie their shoes, which is usually 5 to 6, then they can brush their own teeth. But, I got to tell you, I had 3 boys, and I checked them all the way up until they were teenagers off and on to make
then they
sure
get worse.
They were really doing a good brush. Yeah, good job brushing. So, it's just not the infants that you have to brush for. That is absolutely mandatory. Parents do it. I have parents all the time tell me their 3-year-old can brush well by themselves. I can guarantee you that's not true. So they need to stick with it. But, even when they get into those teenage years, like you're saying, Joel, all of a sudden they're on walking back and forth to school. They stop and get, those big gulp sodas. And, boy, we really need to keep the teeth as clean as possible when that starts happening.
Well, I certainly think home care is a great opportunity, and that's what the Age 1 visit is about in a big way. So I wanted to ask one last question, Kevin. This has been fantastic. If you had one important message for a parent, what would it be?
Well, I'm going to make it 2 because number 1 is they have to brush their teeth, but you already brought that up, and they have to brush their kids' teeth until at least 5 to 6 age. But the other one really comes back to sugary drinks. And, we were a part of some consensus statements that were released by the Healthy Beverage Consumption and Early Childhood Caries, sponsored by Healthy Eating Resources and Research. And we were lucky enough to get us participate with this with the American Academy of Pediatrics, the American Heart Association, and the Academy of Nutrition and Dietetics. And I think this is critical, Joel, that parents understand the first year of life, basically kids have breast milk or formula. You can introduce small amounts of water, not more than 4 ounces a day, in 6 months to 1 year. But basically that first year is breast milk and formula. Going into the second year, you start to move into skim milk and things like that. But I think it's critical for parents to know it's still milk and water all the way through age 5 are the primary go-to beverages. You can introduce small amounts of 100% fruit juices, not the box juices, 100% fruit juices. But basically your go-to things are water and milk. And you know what? From age 1 to 5, my kids didn't go to the grocery store. I did. And you can control what's available to them by what you buy at the store and have in that refrigerator. So I think that's a critical message.
Those are great messages. Kevin, thank you so much for taking the time to be with us today. And this was important not only for our members, but equally, if not more, for our parents out there. So I really appreciate you doing this.
My pleasure, Joel. Thanks a lot for the invitation.
And thank you for tuning into Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice, brought to you by the American Academy of Pediatric Dentistry. We'll see you here next time.
Pedo Teeth Talk is brought to you by the American Academy of Pediatric Dentistry, the show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry. If you have any questions or comments, please email info@aapd.org. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.